My name is Dr. Murphy, and I am with Islip Ob-Gyn. Today, I would like to speak to you about vaginal discharge. Vaginal discharge is one of the more common problems that we see in an office setting. Many women attempt self-treatment for vaginal discharge. In certain situations, this may be okay, but in the vast majority, a trained eye and sometimes diagnostic tools are needed for the proper diagnosis. Vaginitis is an inflammation of the vagina, and there are many causes. One-third of women will have symptoms of vaginitis sometime during their lives, causing them to seek treatment. Vaginitis affects women of all ages, but it is most common during the reproductive years. The common presenting sign in an office setting is a vaginal discharge. Patients will describe either an itchy, thick white discharge similar to cottage cheese, or a thin green or gray discharge with or without itching with an odor. Sometimes there is also pain. Some women simply describe a discharge without an odor and without itching. They feel that any discharge at all is abnormal. It is very important to verify that a discharge is actually an infection and not a normal vaginal discharge. The causes of most cases of vaginitis are usually due to a change in the balance of the yeast and bacteria that normally live in the vagina. There is a normal amount of bacteria and yeast which live in the vagina on a regular basis. When this balance is upset for any reason at all, this causes the lining of the vagina to become inflamed. There are a few factors which can change the normal balance of the vagina. The use of antibiotics can change the balance of the vagina. Changes in hormone levels due to pregnancy, breastfeeding, or menopause can change the vagina. Douching and the use of spermicides for birth control can change the vagina, as well as sexual intercourse. Various sexually transmitted diseases can also change the flora of the vagina. So how do we diagnose vaginitis? The gold standard, which means the absolute best immediate diagnosis, is called a wet mount. In a wet mount, we take a sample of the vaginal discharge and we treat it with a solution to give us better visualization. Under the microscope, we can see yeast, bacterial vaginosis, and a certain type of sexually transmitted disease called trichomonas. Visual examination can also diagnose vaginitis. We place a speculum into the vagina and we look for clinical signs of infection. A yeast infection will usually be revealed by a thick white discharge similar to cottage cheese. There may also be irritation on the outside of the vagina. A bacterial infection will usually be revealed by a green or gray discharge, which we describe clinically as a frothy discharge. Sometimes, to give patients a definite diagnosis of their disease, we will take genital cultures and send them to the lab for identification. Genital cultures are also a way that we identify sexually transmitted diseases, which may not be visible to the naked eye. The diseases that we commonly look for are gonorrhea and chlamydia, as well as trichomonas. Since gonorrhea and chlamydia commonly have no symptoms, taking cultures is a good method of surveillance. This gives us the chance to treat a patient prior to long-term damage happening to her internal organs. Gonorrhea and chlamydia are covered in another informational video that is found within our YouTube channel. So how are these diseases treated? There are oral and vaginal preparations used to treat vaginal discharge. The cause of the discharge determines the type of treatment that we will use for a particular patient. Let's first discuss yeast infection or candidiasis. Turconazole is a common prescription regimen that is used vaginally. There are over-the-counter medications that may work as well. Let's first discuss yeast infection or candidiasis. Turconazole is a common prescription regimen that is used vaginally. There are over-the-counter methods that may work as well, such as miconazole. These treatments range from 3 to 7 days. There is a slight problem when using the over-the-counter treatments. Many women think that they have a yeast infection when they actually have another problem, such as bacterial vaginosis or a sexually transmitted disease. In these cases, a medication for a yeast infection will not work and may cause a delay in the proper diagnosis and treatment of the actual problem. A delay in diagnosis is the prime reason that it is best to have a medical evaluation for any vaginal discharge. So a few questions that we get regarding the vaginal medications that we use for yeast infections. Can I use a vaginal medication while I'm pregnant? Well, during pregnancy, the medications can be absorbed from the vagina and potentially cause adverse effects in an unborn baby. Therefore, it is not recommended to use these vaginal preparations during the first trimester. Can I use the vaginal medications with alcohol? Since the medications are usually applied topically, they have a low risk of interacting with alcohol. It is not generally recommended to drink alcohol while you're sick. Alcohol may indirectly affect how well the immune system can fight off infections. Can I have sex while I'm being treated for a yeast infection? Women on intravaginal medications should avoid vaginal sex, tampons, douches, spermicides, or other vaginal products during the treatment period. We have discussed vaginal preparations, but oral medication is considered by many to be the drug of choice. Diflucan is the drug that is commonly used. This is a single-dose regimen. However, for very heavy or frequent infections, it can be used on a weekly basis for an extended period of time. But there is a downside to everything, unfortunately. As many as 510 drugs have known interactions with diflucan. When we prescribe this drug, it is very important to know the other drugs that are being used by that patient. The interactions may cause cardiac, liver, or renal problems. Here are a few of the drugs that may interact with diflucan. So I mentioned that the vaginal medications are not recommended in the first trimester of pregnancy. But what about diflucan, the oral medication? Current information suggests that a single dose of diflucan that is used during pregnancy has not shown an increased risk of birth defects. Let's now talk about bacterial vaginosis. Bacterial vaginosis is caused by overgrowth of the bacteria that occur naturally and unnaturally in the vagina. The main symptom is increased discharge with a strong, fishy odor. The discharge usually is thin and dark or dull and gray, but it may also have a greenish color. Itching is not common, but if there is a lot of discharge, there may be lots of itching. Similar to yeast infections, bacterial vaginosis is treated with either vaginal or oral medication. The vaginal preparations are 1 to 5 day treatments. These medications are all various forms of metronidazole or clindamycin under different brand names. The oral medications usually have a better success rate. The oral medications are also various forms of metronidazole or clindamycin, again prescribed under various brand names. There are times when either an oral or vaginal medication will not work. In those cases, we will sometimes prescribe the opposite medication for a better result. This means that if we start out with a vaginal medication, we will sometimes change to an oral medication if we feel that a patient has been undertreated or if she did not get the response that we were expecting. When we give a patient metronidazole, it is also important to discuss the side effects of the drug. I commonly ask patients if they have any celebration plans for a particular weekend. In those plans, I ask if they may be drinking. If a patient is taking metronidazole with alcohol, there are very unpleasant side effects. If a patient is taking metronidazole with alcohol, there are very unpleasant side effects during the treatment period and for up to 2 days after the treatment period ends. If a patient has weekend plans, she can sometimes prolong the treatment for a few days. Disclosing these side effects ahead of time is very welcoming to patients and contributes to an excellent doctor-patient relationship. Hopefully you have a better understanding about vaginal discharge and some of the common ways to treat them. As always, it is advisable to seek treatment with your healthcare provider prior to taking an over-the-counter regimen. Thank you, and please join us again.